Hello and welcome to this segment of ASH News TV. I'm Surbhi Sidana, Chair of the ASH Committee of Communications, and I'm here with ASH Secretary Dr. Jennifer Brown. We just had the plenary session concluded, and I'll take this opportunity to talk to Dr. Brown about some of the plenary abstracts that were just presented. So Dr. Brown, many people may not know this, but as the ASH Secretary, the Secretary holds the role of shepherding the abstract review process and everything that happens from submission to selection. So can you walk us through this mystery box of how an abstract gets selected for a plenary presentation? Like, we're all very excited, we submit our work. You know, this year we had about 8,000 abstracts that were accepted, over 1,000 orals. How does one get selected for the plenary?
Well, it all starts with the review committees. We ask the coordinating reviewers to recommend the top abstracts in their group and also to discuss it with the committee. And so we get recommendations from them. Those come to me. We also look at the top percent or two of abstracts scored across all categories, just automatically. And I screen those, basically, and generate a relatively shorter list. And we are always sure we want the plenary to include a wide range of topics. So we like to balance it between basic science and clinical medicine, as well as between malignancy and classical hematology. And then it all comes together at the program committee in September. We spend the better part of half the day actually discussing all of the abstracts that are candidates for the plenary and what will make the best session and what is the most newsworthy science.
Wow, yeah, a lot of work goes into that, and I'm not sure our audience realizes how heavily discussed this is at the program committee meeting. So from the abstracts that were just presented, what were some key themes from the plenary this year, and are there particular abstracts that can be translated into the clinic from the abstracts that were presented?
You know, I think one of the themes, which maybe we're hopefully seeing more and more in hematology in general, is that we're seeing more targeted, better tolerated therapies that nonetheless are more effective than our older therapies. And so we had two randomized trials in the plenary that addressed that, one in CLL and one in AML. So we have the opportunity for time-limited therapy was as effective as continuous therapy in CLL. It's the first time those have been compared head-to-head. So that was exciting. And in AML, we've known for a while that azacitidine venetoclax, the less intense regimen, is effective in older patients. And we heard a trial suggesting that it's highly effective in younger patients. So potentially sparing the more intensive chemo, even for the younger patients.
Was that finding surprising to you?
Not really. I've been working on targeted therapies for most of my career, and so I think the expectation is that the better targeted the therapy is against what really drives the disease, the more effective it may be, and the fewer side effects. So hopefully that's the future.
Anything from the classical hematology space that stood out to you in this year's plenary?
There was an interesting abstract that was actually based on EHR data, and I think this is another theme that we're seeing emerging in hematology, is that we have big data and that we should be mining it for information. And so interesting abstract based on the TriNetX database looked at administration of IV iron for patients with iron deficiency anemia in the setting of acute infection across a range of several different acute infections. And interestingly, the patients who received the IV iron had a very consistent survival benefit, favoring receiving the iron, that was about a 50% improvement after just a couple weeks and sustained at about a 25% improvement after a longer term. And so this is a very interesting use of big data that is providing what seems to be pretty convincing, consistent information across an area that's been pretty controversial.
This is, of course, as we all know, very controversial. In fact, some people say never to give IV iron when someone's infected, so this is like very, very intriguing data. I will ask an unfair question, if that's okay. Do you have a favorite abstract at this meeting?
Oh, from the whole meeting? Well, obviously, I'm a CLL person. So the CLL17 abstract in the plenary we've been waiting for years. So I did enjoy that. One of the plenary abstracts we didn't discuss, a scientific one, is a very interesting study of a subtype of diffuse large B-cell lymphoma that's enriched in people of African ancestry much more than Europeans. And it seems to be related to how genes affect the immune system that allows lymphomagenesis to develop. And it's really quite a fascinating story with potential implications for how we could treat that subtype. And so that, I think, was really quite an interesting piece of science from the plenary session as well.
Thank you. It's been great chatting with you, and I hope you've enjoyed this segment highlighting some of the plenaries. If you missed it, you can always catch it on the virtual platform.